If you're noticing very visible veins in your legs, those bluish lines that stand out like cords under the skin, becoming more noticeable when you stand, feeling firm to the touch, and often accompanied by heaviness, end-of-day pain, ankle swelling, or even nighttime cramps, pay close attention because this has a solution if you start taking action today. It's important to understand something. These veins are not just a cosmetic issue. They are a clear sign that circulation in your legs is not working as it should, that your blood is having difficulty returning properly to your heart. Today, I want to explain in a simple and practical way what's happening in your body and, most importantly, give you 3 actions you can start right away to feel relief. I'm not going to promise that those veins will completely disappear, but I can tell you that you can significantly improve how your legs feel. Stay with me, because I'll also explain when these signs require immediate medical attention. Before we continue, let me give you an important warning. If you notice that one of your legs is very red, warm to the touch, or you feel sudden, intense pain, do not follow these steps. In that case, you should seek medical care immediately, as it could be a more serious condition such as a blood clot. Now, if what you have are visible veins with mild to moderate discomfort, then you can begin this simple protocol. First, elevate your legs. Do this for 15 minutes, twice a day. Lie down and place your legs on pillows so they are higher than the rest of your body. This helps blood return more easily to your heart. Second, at the end of the day, apply cold water to your legs for 1 minute. Move from the feet upward, focusing only on the legs. This helps stimulate circulation. Third, before going to bed, perform a gentle massage. Use your hands and move from your ankles upward with slow, steady motions for about 5 minutes. It's a simple step but very effective. If you repeat these 3 actions every day for 2 weeks, you'll begin to notice significant changes in how your legs feel. I remember a patient in her early 60s who always came in complaining of heavy legs at the end of the day. She started doing these 3 steps consistently, and within a few weeks she told me, "Doctor, I no longer end my day with that intense heaviness in my legs." The veins were still there, but her quality of life improved dramatically. Now, I also want you to avoid certain mistakes that can make the situation worse. The first is believing that varicose veins will disappear with home remedies. When veins are already enlarged and very visible, medical treatments such as laser therapy, sclerotherapy, or in some cases surgery may be needed. What you can do at home is relieve symptoms, reduce swelling, pain, and heaviness. The second mistake is staying in the same position for too long. Whether standing or sitting, if you don't move, the valves in your veins don't function properly and blood begins to pool. Try to move at least once every hour. Walk a little, flex your feet, or make circles with your ankles. The third mistake is using hot water on your legs. Heat dilates the veins and can worsen the problem. Cold water, on the other hand, helps constrict them and supports better blood flow. The fourth mistake is constantly crossing your legs. This habit restricts circulation and increases pressure in the veins. When sitting, keep both feet on the ground. If possible, use a small stool to slightly elevate them. If this information is helping you better understand what's happening in your legs, take a moment to like this video and save it so you can come back to it whenever you need. And if you know someone dealing with varicose veins or heavy legs, share it with them. It could make a real difference in their daily life. Now let me explain in a very simple way why these veins appear. Veins carry blood back to the heart. But in your legs, this job is more demanding because the blood has to move upward against gravity from your feet all the way to your heart. When that system begins to fail, that's when these signs start to appear. If your legs feel heavier over time, if your veins are becoming more visible and you don't understand why or how to improve it, here's the key. Everything starts with small structures inside your veins. When they don't work properly, blood doesn't circulate as it should. But there are practical ways to help your body compensate. Inside your veins, there are tiny valves, like one-way gates, that allow blood to move upward toward the heart. The blood goes up, the valve closes, and prevents it from flowing backward. This is how circulation progresses step by step. Over time, these valves can weaken, wear out, or stop closing properly. When that happens, blood goes up, but then falls back down. And when this repeats, blood starts to pool inside the veins. This buildup increases pressure. Over time, that pressure causes veins to stretch, enlarge, and become more visible. That's what we know as varicose veins. You might be wondering why this happens. Several factors play a role. Age is a major one, since tissues naturally lose strength over time. Pregnancy, excess weight, long hours standing or sitting, and even frequently crossing your legs can contribute. There's also something important you can't ignore: genetics. If your mother, grandmother, or sisters have varicose veins, your risk is higher. Once these valves are damaged, there's no home remedy that can fully repair them. But there is something very important you can do: help your blood circulate better. And when circulation improves, pressure inside the veins decreases, and symptoms begin to ease. That's why the steps I shared earlier work. When you elevate your legs, you use gravity to your advantage. Blood flows back more easily to your heart, reducing pressure in the veins. Cold water helps constrict the veins slightly, improving flow. And upward massage helps manually push the blood, supporting what the valves can no longer do effectively. In my practice, I've seen many cases like this. I remember a 58-year-old man who worked sitting all day. He came in with constant ankle swelling and heavy legs that affected his rest. After applying these simple steps consistently, he told me, "Doctor, my legs feel much lighter by the end of the day." That kind of change, even if it seems small, can transform your quality of life. Now let's talk about what you can expect when you follow this protocol. The first change is usually a reduction in heaviness. Within 1 to 2 weeks, your legs can feel lighter and less tired at the end of the day. The second benefit is reduced swelling, especially around the ankles. That tight feeling in your shoes begins to ease as circulation improves. The third benefit is fewer nighttime cramps. These cramps are often linked to poor circulation. When blood flow improves, your sleep improves as well. The fourth benefit is less pain. That dull, constant discomfort associated with varicose veins can become much more manageable. It may not disappear completely, but it can improve significantly. Now let's organize everything into a clear plan you can follow for 2 weeks. During the first 7 days, every day, you will do the following twice a day, once around midday and once before bed. You will elevate your legs for 15 minutes. If your legs still feel heavy, if your veins are becoming more noticeable, and you truly want to start relieving these symptoms at home, this is the moment to apply the plan correctly. For this protocol to work, you need to do it properly. Lie down on your bed or sofa and place several pillows under your legs. The key is to keep them elevated above the level of your heart. This position helps blood return more easily and reduces pressure in your veins. At the end of the day, when you shower, always finish with cold water on your legs for about 2 minutes, moving from your feet upward. And before going to sleep, spend 5 minutes gently massaging your legs from your ankles upward. During the second week, continue these same steps, but you can add an extra tool: compression stockings. These are designed to apply more pressure at the bottom and less as they go up the leg. You can find them at most pharmacies. It's best to put them on before getting out of bed to maximize their effect. After 2 weeks, take a moment to evaluate. Ask yourself, do your legs feel lighter? Is the swelling reduced? Are you sleeping better? Have the cramps decreased? If you notice improvement, you can continue this routine long-term. It doesn't cure varicose veins, but it helps control the symptoms. In my experience, I've seen patients transform their daily lives with these simple habits. I remember a 65-year-old woman who, after adding compression stockings and daily walking, told me, "Doctor, I finally feel light in my legs again after years." That kind of change truly matters. There are also habits that can enhance your results. Walking at least 20 minutes a day is essential. Your calf muscles act like a natural pump that pushes blood upward. Avoid tight clothing around your legs or waist, as it can restrict circulation. And if you are overweight, losing even a few pounds can make a big difference by reducing pressure on your veins. Now, there is something very important you need to keep in mind. While varicose veins are often seen as a cosmetic issue, in some cases they can indicate a more serious circulation problem. That's why you need to watch for certain warning signs. Seek medical attention immediately if a vein becomes very red, warm, and painful, If the skin around it darkens or changes color, if you develop a wound that doesn't heal near the area, if your leg suddenly swells, or if there is bleeding. These are serious complications that require prompt medical care. If your varicose veins are very large or cause significant pain, it's important to consult a specialist. Today, there are modern, minimally invasive treatments such as laser therapy, sclerotherapy, and radiofrequency that can help without major procedures. Don't ignore the problem. Varicose veins don't go away on their own, and they can worsen over time if not managed. What I've shared with you today is an effective way to relieve symptoms and improve your well-being, but in some cases, medical treatment may be necessary. If this information has helped you, I warmly invite you to subscribe to the channel, turn on notifications, and share this video with someone who may need it. Sometimes, a simple share can make a meaningful difference in someone's life. Let me know in the comments if you've experienced these symptoms or if you're already following this routine. Always remember the essentials. Elevate your legs twice a day, use cold water at the end of the day, and massage your legs before going to sleep. These simple actions, done consistently, can truly make a difference. Before we finish, I invite you to pause for a moment and give thanks to God for your life, for your body, and for the opportunity to learn how to take better care of your health. That sense of gratitude is also part of true well-being. Here on Dr. Gabriel Mina's channel, we are truly grateful to support you with practical tools to improve your health and daily habits. Tomorrow, we'll have a new video prepared especially for you, and I'll be here waiting for you. I'm sure it will help you too.